Happy snow day. Welcome back. Isn't it nice to have 2 Mondays off and 2 short weeks in a row? Here we are. You are taking your first class asynchronously and hopefully at home, cozy and safe. I'm sad we're not in the classroom together, but I've gotten to see you a lot. Welcome from Jesse and Victoria, who got to meet up in Disney World. What a great, fun experience to be able to be together with happenstance, not together, but meeting up. So I've added some pictures in. If your pictures didn't make it, it's just because I recorded this before I received them, and I will be sure to throw them in the following weeks. The first class of fourth semester, I always like for you to practice your oath. I think it seems really far away that you were going to be doing this in Lowell Memorial Auditorium together as a graduating class, but I love to hear you do it together for the first time in this final semester, but we can do that when we are together. So this is a little quote from our buddy Alfred Phones, and just talking about the importance of prevention. So hundreds of millions of dollars in public and private funds are expended to restore the sick to health, but only a relatively small portion of this amount is spent to maintain the health of well people, even though it is definitely known that the most common physical defects and illnesses are preventable. Isn't that interesting that even back in the early 1900s, this is still the case, that so much money, now probably trillions of dollars, is being spent to treat illnesses, and so far less is used to prevent those illnesses. So what is dental public health? Okay, it's the art and science of preventing and controlling dental diseases and promoting dental health through organized community efforts. So dental public health serves the community as the patient rather than the individual through research, health promotion, education, and group dental care programs. The dental hygienist was created from the realization that dental hygiene or mouth hygiene was a necessity, and that the dentist that they had, this dental practitioner, didn't have enough time to be able to help and support and educate this patient base. They were only there to treat. So this is how our role in dental health came about. This is a very important image or graphic, and you know when I say something is very important, it means it is going to be it was probably going to show up on some exam questions. It's probably going to be on the boards. It's probably going to be in a testlet. So the 3 core functions of public health are assessment, policy development, and assurance. So what are we monitoring? What are we assessing? What is the program or the partnership or the funds that we need? And how can we assure that after evaluation that the standards are being taken care of, the program is running efficiently, and we've set out to do or meet the goals and objectives that we've had. So this is supposed to be a class exercise. I wanted you guys on your own to determine what these images mean and how they relate to public health. So we have fruits and vegetables, we have the seatbelt, some roads, water, Coca-Cola, the syringes, vaccination. Then we have Candyland and ping pong balls. So maybe when we come back and we're in person, you can do a little research on your own and tell me what ping pong balls and Candyland have to do with public health. So public health is not only shaped by clinic and clinicians and policies, but it's really influenced by simple everyday things to prevent disease before a treatment is needed. So many of these same ideas apply directly to oral health prevention, so and access to care, but also patient education. So we want to figure out or discuss what these certain things that have come about or situations that have happened that have helped propel the need for a program or a policy within public health. So we have vaccinations and immunizations, which we're constantly still dealing with, updating, fighting against or for the need for motor vehicle safety, introduction of seatbelts. I think about all the car seats my children have used over the years and how long they need to be in them. Workplace safety, OSHA. You will be part of OSHA training once you are an employee. Infectious disease control. We just did this with COVID, right? The immunization, all the safety protocols, safer and healthier food, a constant, right? What pesticides should be in there? What should be out? What chemicals are safe? What should be in our foods? Who's managing our foods and the safety of it? Family planning, birth control, and fluoridated drinking water. A huge change to public health, but also maybe not within our country, but an issue, safe drinking water in other countries. Fluoridated water is at the top of the policies and state by state and what's happening in our country. And recognition of tobacco use as a health hazard. And now today we're talking about vaping, right? That is a public health problem that our teens and young adults are up against. So we're going to just go through some objects that shaped public health. This is kind of fun, thinking about, what happened back when that now we have a warning or a policy about that. So the meningitis vaccine. So what happened was children, once they started living together in colleges, so closer proximity, this vaccine had to be developed to help prevent meningitis. I think about speed limits. So if you go back in time, we did not have different speed limits, monitoring how fast we can be on what type of roads and what type of highway. Sidewalks. You'll hear a lot about this actually in your IPE session with the nurses. They do a community health project. And one of the things they talk about for safety in towns, or what makes a town or a city safe to raise children, is how many sidewalks, where are their sidewalks? This is access to transportation, all of the things that make a difference with this. OSHA, this is regulation, a federal regulation that helps protect workers. Mosquito nets, we think about a very low-cost intervention that prevents serious disease in Africa, where so many different rampant diseases can kill people. Bifurcated needles, this goes back way in time. It was just a simple design, and that helped eradicate smallpox. Someone who invented a bifurcated needle, they were able to start the progress and eventually eradicate smallpox. Caution hot labels on coffee. You guys, probably most of you weren't around. They didn't used to be caution labels on coffee cups until a woman put her McDonald's coffee between her legs and the coffee burned her nylons into her skin, and she won a very, very expensive lawsuit. The refrigerator, of course, we're able to keep our food much longer now that we have refrigeration. Things we take for granted. Tamper-resistant caps. So this is what keeps children safe from going into the medicine cabinet and opening medications. The birth control pill. This came out to help women prevent pregnancies. Fluoridated toothpaste, of course, a public health achievement that simply reduced cavities, dental caries across all populations. It was easy, it was accessible, and it was relatively cheap for most people financially to be able to utilize. Warning labels on cigarettes. Not always did people believe that tobacco and cigarettes were harmful, but now we know with tobacco cessation and counseling that this is knowledge that we now know. By warning patients or educating patients, we can dramatically improve oral and systemic health outcomes. Oh, here are our class cuties. I don't have a updated picture of our baby Vita, but here she is. And then here is Ashley's adorable children right before or on Christmas morning. Thank you for sending these. Social determinants to health. So we talked about this last semester. This is what people need to be able to achieve or get health care. Okay, it could be dental, it could be medical. Okay, so availability of resources to meet daily needs. Think about Maslow's food, shelter, safety, access to educational opportunities. We can't change something if we don't have knowledge that it's causing a problem or it is harming us. Access to jobs, right? Employment, to be able to be financially stable or access other certain things like healthcare. Quality of education and job training, availability of community-based resources, transportation options. If you live in a very rural area and there is no public transportation, how are you able to get to work, to get to medical care or dental care? Also, public safety. The support of your family or social network is certainly helpful, right? If you don't have someone that's checking in on you or your health is not important to somebody else, how can you feel though you're deserving? So social norms and attitudes also affect that. What are people culturally or socially accepting of certain types of medical care, medical treatment, dental treatment? Okay, what is thinking about distrust in medicine due to historical use of marginalized populations. We'll talk about the Tuskegee study. You'll talk about a lot of this in ethics. Also exposure to crime and violence, or maybe a mental or social disorder, socioeconomic status, residential segregation, not being close to access any sort of health care. Language literacy. So we learned what dental literacy is, having accurate knowledge and decision-making skills to maintain health or oral health, and also enable individuals to, know why these certain types of treatments or preventative treatments are going to help benefit them long term. Access to mass media and emerging technologies. So being able to see things on TV, social media, public service announcements. And then, of course, culture is a big one, right? And culture kind of follows in with a lot of these. I think social norms and attitudes, also residential segregation. So while Shayla was in paradise in Puerto Rico, I was, home in my freezing cold backyard. That's an ice rink out there. It's not in great shape right now, but we had some great days on it in December. So because we're not in class, we would be watching this video in class. So you have a link to this on Blackboard. You're going to watch it. I want you to start it at 25 seconds. You don't need to watch the very, very beginning. And then you can end it at 4 minutes. You don't need to watch the whole thing. But after you watch that, I want you to reflect on it, think about it. And there are going to be some questions, which are right here. They're also in Blackboard. It's an assignment now. It wasn't before, but now that we're not together, I would like you to answer these questions and upload them to Blackboard, please. Thank you. Victoria, this is Victoria's new friend who she met in Florida. And then we have Shayla, again, in her trip to Puerto Rico. She got to go to the bioluminescent bay, which I imagine in here is quite remarkable. So when we think about public health, and we talked about different public health problems that were solved, I always now will forever think of COVID. That was a huge current public health crisis that we witnessed firsthand, and we will share with our children and grandchildren for years to come. But what makes a public health problem a problem? some of the current public health issues I think about are vaping and adolescence and social media. Okay, so what makes a public health problem actually an issue? Okay, so it has to be a condition or situation that's widespread, potentially could cause morbidity, disease, or mortality, or existing perception that this condition is a public health problem on the part of a public government or public health authority, right? So using social media as an adolescent or a young teen or preteen is not going to kill you, but it certainly could cause mental illness and other conditions that people are concerned about. So think about the difference between, COVID, which is a public health issue, a pandemic, and then also some smaller scale things that are at the forefront right now, such as vaping and social media use. Type 2 diabetes, a perfect example of a constant chronic public health problem. Okay, so what's the problem with type 2 diabetes? Okay, so in 2025, more than 38 million Americans had type 2 diabetes. Okay, or 90 to 95% of them had type 2. So that's 1 in 10 people, okay? So the annual cost that the United States spends on treatment and prevention of type 2 diabetes is $413 billion. It is the most expensive chronic condition currently right now in our nation. So that means $1 out of $4 in U.S. healthcare costs is spent on caring for people for diabetes. So is there a prevention and is there a cure? When we look at public health and we think about how can we prevent certain conditions, there has been billions of dollars spent on how we can prevent and reduce the amount of patients that have prediabetes, type 2 diabetes, but also how can we shift from this pharmaceutical issue and shift to prevention, okay, health and wellness and nutrition. It certainly is an economic burden when billions of dollars is being spent, and certainly socioeconomic status and other factors, social determinants to health are affecting that. So is everybody in this country dealing with the same type of thing? Is everyone getting the same access, the same care? Is there disparities among certain populations? So this is a great example of something that is chronic and ongoing and has been. Ashley Marama looks like she's probably a little bit better on the slopes than I am. I think they call it a yard sale when you fall on the mountain and your poles and skis go everywhere. But that happened to me twice over winter break. Skiing is not my favorite thing to do, but as you can see, my children and husband are thrilled to be up on that cold mountaintop. So I hope that if you all love skiing or snowboarding, you got a chance to do that over break. This seems simple, but this is important to remember. This is going to come up on the boards, and it's also going to come up on your exam. So when we talk about public health, we can't not talk about funding, aid, and the governmental levels of public health. So internationally, we have worldwide, we have federal, which is our country, United States. We have the state we live in, Massachusetts, or if you live in New Hampshire. And then we have local. What town or city do you live in? And there's all different types or levels of public health, depending on if we're talking about on a global scale, as in the COVID pandemic, the federal scale, our country, which changes in flux with who our leadership is, state, again, changes based on who our leadership is, and then local, different branches and how you can help and support your town and state locally. So for examples of each level, for federal, these are your federal levels of government that are going to have a lot to do with public health. Your National Institute of Public Health, we call that NIH. So you will see this probably on boards, and you want to know that is a federal government agency. Next is our Food and Drug Administration. You know that from nutrition. Center for Disease Control and Prevention, our CDC, which we get all of our infection and immunization protocol and policies from. And the World Health Organization. Okay, the World Health Organization is actually international. Sorry that does not have its own slide. It should be international. And then the second international is International Federation of Dental Hygienists. So you could be an ADA member or you can be an IFDH member. So what does the state agencies do? So state's going to provide consultation services to local health departments. They're going to administer some programs. They're going to allocate block grants. So what's a block grant? A block grant is an annual sum of money that's usually awarded to a state by a federal government, okay? Or it could be awarded to a local, a town by the state. But right here, we're talking about block grant being awarded to a state from the government. I think about food programs in schools. I think about allocations of funds during COVID. And so usually the fund, if it's a block grant, it's going to be meant for something specific, okay? The state can't use it for whatever they want. The federal money will be allocated for something specific. So oftentimes this might be, awarded for education, maybe for IEP programs, so individual education plans, or could be for urban development, creating parks. Some of our state governmental agencies for public health are the Mass Department of Public Health. We also have the Executive Office of Health and Human Services, and then we have the Board of Registration and Dentistry. So those are both in Boston. The local is going to be town and city. So this is like a people-to-people level of public health. Every city and town is going to have their own public health administration and building. You can visit yours when we're listening to the nursing students for IEP. When they do their community health project, they all went to the Department of Public Health within their town or city and got a lot of information to be able to do their project. So when we think about local public health initiatives, administering immunization, so during COVID, towns and cities put together, I think about Lowell, Lawrence, huge open spaces where people can get vaccinated, health fairs, which we've been to and will continue to go to in some places like Tewksbury Hospital. I think about Tewksbury, their senior center, Bill Ricca Senior Center. Food pantries are also a public health measure that most city and towns have. That's something certainly to look into in your city and town. Who manages the food pantry? How can you donate to the food pantry? How can you utilize the food pantry? How big is it and where is it located? And then also family planning. Here are some furry cuties. I think this puppy on the left is Ashley McIntyre's. Shayla, I don't know if your kitty went to Puerto Rico with you, if that is a Puerto Rican kitty that you just made friends with. And then I assume this is Ashley Marama at work with this cute little pup. So let's talk a little bit more. We'll do an activity so we can understand a little bit better these federal government agencies. So this is our first example, okay? Something like this could be an exam question on exam 1. So a State Department of Public Health applied for a grant from the CDC to assess the oral health needs of 3rd graders. The state received a block grant in the amount of $50,000. Schools were selected from across the state using a random survey. Manpower was needed to survey the children's oral and dental condition. Public health personnel contacted county health departments within dental facilities to conduct surveys in the schools selected. Okay, so what level of government conducted the surveys? Okay, so here I'm reading on the bottom, it says conduct the surveys in the school selected. So when I think about school, I think about town, and I believe that is a a local government level. Okay. What about what government level, local, federal, or state, managed the block grant? Okay, so who managed it? Different from who provided it, okay? So the state received a block grant, okay, and they decided who was going to get it, okay? So the people who received it, that's local, but the people who managed it is state. And then finally, what level of government supplied this grant? If the CDC supplied the grant and your answer was federal, that would be correct. Okay, so here we go. These are what we just answered. Okay, second example. A State Department of Public Health applied for a grant from the National Institute of Health, or NIH, to assess the benefit of mouth guards for youth soccer players. The state received a block grant in the amount of $75,000. Youth teams were selected from across the state using a random survey. Manpower was needed to survey the athletes' use of mouth guards. Public health personnel contracted city health departments with youth soccer teams to conduct the surveys. Okay, so what level of government conducted the surveys? This would be the same. Local city health departments, people within the towns of the teams. Next, what level of government managed the block grant? This is the same, the state. Okay, and then lastly, NIH, is that a federal, state, or local level of government? It is federal, so the federal level is who provided or supplied the grant. Okay, so let me know next week if you have any questions about that. Characteristics of an ideal public health measure. Okay, so when we nationally, federally, when they determine what is a public health crises, how can they create a public health measure, meaning how can they reduce, prevent, or solve, okay? So, and what program needs to be developed or put into place, or PSA or prevention education method, okay? So it has to be proven to reduce the target of disease. So what public health measure, what program, or what is being done, will it be proven to target this particular disease, condition, or problem? Is it going to be safe to the public? Is it easily and efficiently implemented? How is it going to be rolled out, state-wise, federal-wise, or locally? Is it easily administered? So if we're doing something that's dental, would a doctor be able to do that? Going back to COVID, people from all over the healthcare field who were able could immunize against COVID, and they had all boots on the ground to be able to do what anyone could do. Is it attainable regardless of socioeconomic status, education, income, race, age, or sex? We want to make sure that everybody has access, no matter, that means they're fulfilling that social determinants to health, and everyone is able to equally get access. Is it available and accessible? Yes. Inexpensive and affordable, or fiscally responsible, easily learned by users. So if we have to teach the public how to do something, are they going to be able to do that on their own? Using a mosquito net in the jungles of Africa to prevent malaria is going to be a simple way to prevent mosquitoes from coming in and biting people. I also think about community water fluoridation, accessible to everybody and relatively inexpensive. Does it receive maximum acceptance by the patient? If people don't want to do it, or they're afraid of it, they're not going to do it. So it's not going to be effective. And it requires minimum compliance. Okay. So when we had to wait in line to be swabbed, COVID tested, some people would wait in line for hours. Other people weren't as compliant. Also getting vaccinated, right? It became something that we wanted to get on that list, right? We wanted to be able to do that. And now we've learned a lot since that has happened, that when everything rolls out, it's not always perfectly planned, because there's so many things to consider and so many unknowns. It's always easier with hindsight. Here are Ashley's friends and family, I believe. Ashley sent me lots of pictures. Thank you. Looks like a fun and busy break. So, community water fluoridation. It's a big topic. It's a hot one. When you go to Yankee, if you're going to student RDHA, I'll be interested to hear, what they're saying out there to try and get through to the public, to our patients, to just, put it out there that we are doing what we can to spread the word that, fluoridating water is a benefit to all people, not just the people that don't need it, right? Like, people want to take it out because they're able to get dental care and they're able to get fluoride, but that doesn't help the people that don't have access to professional dental care and don't have access to professionally applied fluoride. So does community water meet the characteristics of an ideal health measure? What do we think? Yes, right? So fluoridating water was probably one of the easiest and most wide-casted net of a public health resolution to a problem by decreasing caries. So the question is, if we talk about, when we're talking about community water, fluoridated water, bottled water, this will come up on boards. We want to know what government agency is monitoring all of these things. So which government agency monitors the concentration level of fluoride in a community drinking water? Think about what agency is that in what level of government. Okay, so the agency that monitors drinking water is the EPA. That's the Environmental Protection Agency, okay? And that is going to be a federal agency. When we think about bottled water, this is also going to be a federal agency, a hint with the word federal. And if you remember this from nutrition, the answer is going to be the Food and Drug Administration. So the FDA sets limits for bottled water and fluoridated bottled water because it's considered a food product, okay? Because it's on the shelves, very different than tap water. And then lastly, and then which level of government are these? So they're all federal. I guess the easiest way to remember that is tap water is EPA, bottled water is FDA. Both of those agencies are federal. When you're thinking about your own tap drinking water, that becomes state. But if we're talking about management and monitoring of fluoride, these are the answers to that. So just something to remember. Fabulous. I was going to call this funfetti sourdough. This is not my sourdough. I did not find a way to fit that in over break. I killed my starter. I will need more. But this looks beautiful, and I am sure, Ashley, it tasted just as good as it looks. Wrapping up, these are our roles. So if any of you, and I hope maybe one of you will, go into the role of a public health dental hygienist, you know that you have a lot of opportunities in your employment as a dental hygienist, right? There's lots of things. The world is your oyster. But as a public health dental hygienist, those roles are a little bit similar. So I am not a public health dental hygienist. I'm an educator. But if you are a public health dental hygienist, you also can have a role as an educator. Okay, so that role is going to be getting out into the community, just like you guys are all doing, and providing education about the importance of oral care and dental care. It can be anywhere. It could be in schools. It could be in nursing homes. It could be at veteran hospitals. a role as a public health researcher, you're going to be determining, how can we determine, who's at risk for periodontal disease with what type of condition in nursing homes. So anyone that's going to cover like a vast population of a community, oftentimes underserved populations. Administrator, manager, advocate, these are a little bit similar. So an advocate, I would also call this agent of change. And then we have clinician, and that would be a public health dental hygienist. And this is constantly changing, right? We have more and more states offering this role. It's something that I hope that, a few of you look into. It's certainly different than working under a doctor. But remember these 6 roles. So here they are. I'm kind of laid out to you. That, did I say consumer advocate and change agent? Yeah. I put both here. So consumer advocate and change agent. The difference there is when we think about lobbying, hopefully sometimes it falls in April. You can go to the State House. There's a lot of different policies that are up for debate with Botox and fluoride. So it's really good to always keep an eye on that. You're also advocating. You could be advocating for a certain population, a certain underserved population, or you could be advocating for the career and different policies. And then we already talked about educator, researcher, and then administrator. That's more of I think of that as a coordinator within certain public health programs. So just for review, those 6 roles, you're in a new position as a dental health consultant at the State Health Department, a state government job. You're asked to conduct a statewide screening project to determine the oral health status of school-age children. After you collect and analyze the data from the statewide survey, you are to determine what oral health program you would like to plan that will address the needs of children in your state. So I think there's a couple answers that fall within here, but when we read board questions and then we read the STEM, and then you go back to the question, what is this question asking me? Your position in the screening survey, data collection, and analysis falls mainly under which of the roles of dental hygienist. So the answer here is researcher. Okay, but I can see how you're saying, oh, you're a dental health consultant, and then in the bottom it says that you are going to determine what health program you'd like to plan. So you're not planning the program. If the STEM had talked about you planning a program, that would be probably change agent. If you're working within the program, that would be clinician. If you're promoting a program, that would be an educator. If you're helping to coordinate, you would be the administrator. So we have a little rationale here. So research involves surveys to collect and analyze data. So when you see analysis, collection of data, research is probably going to be your go-to. You also in public health might be juggling multiple roles, so that's always good to keep in mind. But an administrator means that you're probably supervising, collaborating, organizing within a certain department. I think anytime you see change agent, this is going to mention legislation, policy, or lobbying. Clinician, this means you're actually doing the clinical work as a healthcare provider. And then a healthcare educator within public health is going to be presenting, educating, providing information. So I hope that that all makes sense to you. I'm sorry we're not together. I will leave you with this. Doctors or clinicians have the ability to change their patients' lives. Public health has the ability to change the world. And this is by Dr. Alfred Demaria, who is a infectious disease specialist, actually. So thank you for listening, and I hope you're all safe and well. Oh, and I'll leave you with my 2025 Spotify wrap. Do what you want to do with that and share yours next time we're together. Bye.